So today, I'm gonna wrap this up. I invite you to join me and others today and tomorrow and the next day in envisioning and creating a future healthcare system where purchasers, their employees, healthcare workers, risk managers, patient safety officers, insurers, and patients can combine our hard-won knowledge, our wisdom, our passion, and our courage to do what is right. And that is to co-create a healthcare system that is safe, transparent, compassionate, respectful, and just for all involved in healthcare. I've had 10 years, well, 11 years, witnessing the evolution of patient safety. I have met fearless, determined, bring it on mentality leaders that inspire me. And again, leadership is a choice. Change is indeed possible. I have also met those unwilling to depart from the familiar and the shelter of the safety of the status quo. Status quo and familiar are not going to save lives or transform healthcare. Which one are you? Oh, I'm not done. With this Affordable Care Act, Partnership for Patients, and all the big challenges set before us, in order to achieve these provocative goals, I am absolutely convinced that we must immediately mobilize the patient population to achieve reduction of harm and readmissions. Leapfrog, it is time to raise the bar. Create a gutsy new paradigm by activating and mobilizing patients. Let's pursue public pressure and the voice of the patients, and let's save lives. So back to the reporter. In his interview, he also said, "Mr. Sheridan, you probably never imagined that you and 7 other moms would be successful in changing the standard of care in the United States and Canada." And I thought about that for a second. And my response to him was, "Oh, yes, we did." So when you leave this event, leave imagining that indeed we can accept the challenge of change, keep hope alive, push beyond the barriers, commit to patient safety, and achieve the goals set before us. When Pat had about 10 days left to live, he shared with me that he wanted to go to Disney World to watch his family and friends have the time of their lives. MD Anderson was like, "How can we help?" And so we got on the phone, we called Disney, we called United Airlines. In just a matter of days, 53 of us were flying to Disney World with Pat, who by this time was paralyzed from the neck down. And while we were there, we had precious discussions about what I was going to do, raising our children without him. And Pat said to me, I mean, he didn't lose his sense of humor. He was sipping wine through a straw, and he said to me, my maiden name was Brown, and he said, "Brown, whatever you do," he said, "don't give up on patient safety." So Leapfrog, I ask the same of you. Never give up on patient safety. You have the power. You have the knowledge, you have the spirit, you have the will, you have the leadership, and you have the capacity to save lives. You have enormous patient populations at your fingertips that can serve as a valuable resource that can guide you and teach you as you pursue their health care. Act with urgency, be bold in your vision, be persistent when it's hard. Activate your patients, engage them, learn from them, teach them, capture their stories, their wisdom, and their vision for a safer healthcare system. Invite us to participate in the improvement of our healthcare system. Be transparent with data, with outcomes, with risk, your successes, and with your patients. Chase zero, as Lucian brought up, the zero, and believe it is a cheap and powerful tool. So my ask to the audience would be to embrace the concept and model of where patients really set the agenda and to recognize consumer groups such as CAPS as valuable assets. Partner with us, support us, teach us, learn from us. My other ask is that of just about any patient I have ever met. So if I were an employee of yours or a patient in your hospital, I would expect the employer to choose the absolute safest hospital possible to assure that whatever hospital they choose as my healthcare provider, that the hospital have a patient and family safety council. There are patients helping in governance of that hospital. That we're involved in all aspects of the design of care in safe and just healthcare. This is patient-centered care. So in honor of those who have died, those left disabled, our loved ones today, and the world's children yet to be born, we will strive for excellence so that all involved in healthcare are as safe as possible, as soon as possible. This is our pledge of partnership. Thank you very much.